The Young Cancer Nurses study comes off the back of a lot of work done by EONS over the last 5 years. EONS has made several really important and significant commitments to the development of young cancer nurses, including the appointment of a Young Cancer Nurse Board representative since 2017, which was made into an executive voting position in 2019, and has also provided workshops for young cancer nurses in addition to our broader educational efforts around oncology nursing and specialist nursing education. So I suppose a little bit of background to the study is that, we are in a very exciting time for someone to be graduating from nursing and coming into the profession for the first time. There's never been more opportunities in terms of to develop into advanced practice and specialist roles in cancer care or education or even research roles. But I suppose this is all happening against a backdrop of a very significant changes in society. We're seeing the rise of the gig economy, there's increasing employment precarity and higher expectations of university graduates about what they're prepared for when they enter the workplace for the first time. And then we are also in a changing world. So the current generation have grown through enormous uncertainty. They've grown up in an economic recession. They've seen huge rise of political tensions, pandemics, terrorism, and rapid and environmental changes and disasters over the past, particularly 20 years. We have a confluence of factors going on here that are affecting the motivations, the energy, and the optimism of this generation that are coming forward now into the workforce. And at a time when their motivation and their passion should be at their peak, what we're actually seeing is that many nurses are graduating and pivoting into other professions, or they immigrate from their home countries because they don't see opportunities for their professional development and their career. And what we're facing very realistically is that in the context of an aging workforce over the next 30 years, we are running the potential where we're going to lose that older generation, but also that we're going to lose that younger generation as well. So there's important considerations around the sustainability of the nursing workforce in the context of these issues. So EONS sponsored a study conducted by its young cancer nurses between 2018 and 2020. And in our first study, a survey of 378 nurses under the age of 35, what we found was that 15% of our participants didn't feel motivated in their current roles, and as many as 20% didn't see themselves remaining in the profession beyond the next 10 years. These are really important concerns in the consideration of the changes that are coming and that are happening as we speak, and how we retain these young nurses is quite important. So with the information from our survey study, we undertook focus groups with 20 young cancer nurses from 9 different European countries. And what we sought to do in this study was to better understand their experiences as young cancer nurses and what they felt their needs were in order to secure their professional development, maintain their motivation, their positivity and their enthusiasm to follow this profession and remain in the profession of cancer nursing beyond the trajectories that we were seeing. The really important findings that we have were naturally around the issues around access to education and professional development, which we could see in the survey. But our focus groups provided a lot of important information around the barriers to education and professional development. So we knew that having time to get away from the workplace to engage in education, but also the finances to pay for such education was really important. And I think when you look across Europe, what we know from our RECAN study is that there's different recognition around the specialisation of oncology nursing, and that has affected how nurses, whether or not nurses can access specialist education in oncology. In countries where it's not recognised, typically they can pursue generalist postgraduate education, but they can't obtain that specific cancer-specific postgraduate education. Other things that we identified as well were, as you might expect with a young generation under the age of 35, is that they had other commitments in their lives that interfered with their ability to engage with education and professional development. And often these nurses are generally at a very busy period in their lives. Many will have children, but some even spoke about the commitments that they had to caring for relatives. So these were all factors that influenced their ability to engage with education. The second really important finding that we had from this study was how nurses are acculturated to the clinical cancer environment. And I think this is really important regardless of whether or not the nurse came from a country that recognised the specialisation of oncology. What we found was that often induction to a cancer care environment was quite generic. There was no cancer-specific information within those inductions. It was often an introduction to the organisation in which they were working. And many described having difficulties in accessing mentorship and support to develop within their role, to learn on the job, and to develop that clinical competence that's needed, and particularly around the areas of administering chemotherapy and managing adverse effects of cancer treatments. Other challenges that we identified were around safety issues and debriefing. So nurses were reporting that they felt, the young nurses in particular were reporting that they had a lack of confidence with as some of the more advanced aspects of their roles. And they saw that there were safety issues that could arise, particularly where there was no specialist education available to them or their colleagues. So we had heard stories of nurses who were working with inadequate PPE or inadequate understanding of the cytotoxic drugs that they were administering. And several identified that where safety adverse events did happen, there was inappropriate debriefing. So often there were challenges around looking at the issues that had contributed to the adverse event. More often it was more of a psychological debriefing that took place. So this led to many of our nurses feeling that there wasn't an appropriate purpose to the debriefing that was taking place, and it didn't have the patient at the centre of that debriefing process. But in a very positive finding, what we did see was that young nurses who had come through the stress, the worry and the anxiety of engaging in a specialist role were very conscious of the issues that new young nurses entering their environments experienced. And they took great efforts to mind the young that were coming into that environment, trying to provide support and advice where possible, but always with the cognizance that they were not necessarily an expert in oncology, but they could help avoid some of the uncertainties and distress that took place that they experienced in their own acculturation to practice. So I suppose the key needs that came out of the study were around the need for kind of protected time and some financial support in order to engage in education. A clear need was for mentorship in acculturating to the clinical cancer care environment. So many described this need to have ideas, have formal mentorship around how they engage with career development opportunities, planning their career to follow the career trajectory that they had preferred, and finally being empowered within practice and to take on leadership opportunities, because often many felt that their opinions and ideas for innovation in practice were overlooked due to a perception that they were young or lacked experience. So the next steps for the EONS Young Cancer Nurses Network is to come away from this with some of the key findings around skills-based needs that young nurses identified. So from the Young Cancer Nurses perspective, what we'll be doing over the next 2 months, we'll be running a Nightingale Challenge series, which will target issues around resilience, leadership and career planning for young cancer nurses. And there's further information available about the webinar series and the registration from at cancernurse.eu. And from there we go forward. We hope that we can inspire younger and older cancer nurses to take on the opportunities to mentor young colleagues, inspire them and motivate them to remain in the profession, and to show them that what's possible. And I suppose the changes that we make today to support young cancer nurses might be small, but what is really important to remember is that from every small change, big things happen. So what we will see from today in 10 years' time, the small efforts that we make will become bigger, and we can potentially avoid many of the concerns that are identified by today's young cancer nurses in future generations of young cancer nurses, and develop a sustainable, positive workforce who are motivated to provide top quality cancer care to our patients. Thank you.